Welcome to Nursing 175 Clinical. My name is Linda Kavanagh and I will be your clinical instructor for the next 13 weeks. And I'm pretty sure right away you get the sense that my approach to teaching is probably a little bit different than what you're used to. Some days you're going to think this is fantastic, and other days you're going to be thinking to yourself, man, why can't you be like everybody else? Don't worry, it's all going to work out. So here we are. This is the day you've been waiting for. You're ready to leave the classroom and actually walk into a hospital setting and meet a real patient. And now you're thinking to yourself, is there any way I can get out of this? Seriously, it's normal to be a little bit nervous, but it'll pass and we're really going to have a great experience. I guess I really just wanted to inspire you to come to orientation Monday with a sense of curiosity and a willingness to be engaged and interactive throughout the whole kind of morning. And I know you were thinking to yourself, well, I'm really just kind of hoping that I'm somewhat awake and alert. Totally understand. But seriously, I really enjoy teaching and I really enjoy hearing students' ideas and opinions. But what I've learned from students, and especially first-year students, is oftentimes they'd like a little bit of a heads up about what's going to be covered so they can prepare their thoughts ahead of time. We're all pretty familiar with that feeling of, oh my God, is the teacher going to ask me something and I'm not going to know the answer? But Monday's really all about getting to know each other and figuring out together what the whole goal of clinical is. What the course expectations are, what my expectations are, what your expectations are. What are you hoping to get from the course? What are you hoping to get from me as a clinical instructor? What are you hoping to get from the overall experience? So to get you thinking about some of these things, I want you to look at a few things before you come to clinical orientation on Monday. I know, you're thinking to yourself, seriously, homework before we even start? It won't take that long. What I'm really asking you to do is to just trust me. I'm asking that you trust that my most important goal is to see you become successful nursing students. Everything I do is with that goal in mind. I'll always explain why I'm doing what I'm doing. And if it doesn't work and it doesn't meet your learning needs, I'm always open to change. And if neither of those options work, you just need to keep the image in your mind that just how crazy is this instructor. This little video really was born out of suggestions by other students about ways to help them feel more engaged and prepared for each clinical day. So, first thing you're going to do is you're going to access Blackboard. Yes, our favorite Blackboard site. And you're going to look for Nursing 17501C. That's the number of our particular clinical rotation on Monday. You're going to see my folder, Linda Kavanagh, on the left-hand side. You want to click on that. Now, this folder was created for me and you. Myself and you students in my clinical group are the only ones who can see this folder. So you're going to see 5 different folders after you click on my name, and the first one is going to be week 1, and then you're going to see 4 resources folders, and we'll go through those a little bit this week and next week. But the most important one is week 1 orientation. So when you click on week 1 orientation, the first thing you're going to see is, or what you're going to look for is, you'll see a preparation checklist for orientation. Now, in that, when you click on that checklist, you're going to see 12 things that I'd like you to do before you come on Monday. Number 1 and 2, pretty self-explanatory. Might be a little bit hard first thing Monday morning, I understand. Next thing you want to do is you want to review pages 41 to 49 in your student handbook. Don't worry, you don't have to go digging through, oh my God, where did I put that? What drawer did I put that in? I've uploaded it for you in the Resources to Understand Nursing 175 Expectations folder on Blackboard. I find students often have a lot of questions before they come to orientation in terms of, what color shoes do I have to wear? What color uniform can I wear? Can I wear nail polish? All of those questions. If you review pages 41 to 49, it's going to cover all those nitty-gritty details. You'll also see that one of the expectations are that you bring a record of your CPR, your N95 mask test, your AHS General Student Orientation, and it's your MOVE online module completion. The next thing you're going to see is something called a learner assessment. And so you're wondering, well, what is this? So you're going to learn about the nursing process and you're going to learn about assessment. Well, as an educator, it's important for me to understand who you are as a learner and what your learning needs are. So I'd like you to fill that out just to give me an idea of who you are as a learner. And while you're filling it out, think to yourself, I wonder how this might correlate to nursing and how I assess my clients. And why might Linda be asking these questions? The next thing you're going to see is number 6, review the Nursing 175 learning outcomes. So, you know that course outline you get? I know, and you tuck it away at the back of your binder and you really don't read it. Well, you're going to want to pull it out. Not even the whole course outline. I've been kind enough to just upload the Nursing 175 learning outcomes. And you'll see, oh, these are kind of some of the things that they're looking for us to be able to accomplish, or this is what they want us to look like by the end of this clinical rotation. It's just 12 points that you want to have a quick read over. And to help you understand that nursing is continually about evaluating. Who are we becoming? How are we acting professionally? So I've listed here, review page 5 in the Entry to Practice Guidelines. This is found in the Resources to Understand the NPET folder on Blackboard. And identify the component that specifically speaks to nursing students. I bet you weren't aware that some of our standards of practice and some of the things we have to do as nursing instructors and nurses on the unit actually are with your best interests at heart. So it's just a quick paragraph on page 5. You'll also want to read, there's a couple of paragraphs on page 14 and 19 in the Code of Ethics document. This is also found in the Resources to Understand the NPET folder on Blackboard. And identify those that specifically discuss nursing students. We'll have a conversation about those on Monday. I'd like you to come prepared with just a list of opinions and ideas about the meaning of professionalism and accountability. And we're going to go through a little exercise about how to develop inquiry-based questions. And we're going to start with some of our opinions and ideas around professionalism. Please come prepared to share your expectations for your first clinical experience. What are you expecting from the staff? What are you expecting from patients? What are you expecting from your peers, your instructor? What are you expecting from yourself? Come prepared to tell me a little bit about yourself. Where are you from? Family, friends, hobbies, your nursing goals. And last but not least, come prepared with a list of any questions not answered in the Nursing Student Handbook or that require clarification, and we'll go over those Monday. That's it. It's not too difficult. Each week you'll get a little reminder in this type of format, just to kind of help you prepare for each clinical day so you come knowing what to expect. I really look forward to meeting all of you, and I'll see you first thing Monday morning. Okay, thanks.